咁我今日就要嚟講翻week 8嘅呢堂 lecture 啦，就係關於 nurse-client relationship 嘅。咁by the end of this section 咧，我哋應該學到點樣 define 呢個 nurse-client relationship，點樣 differentiate social relationship from therapeutic relationship，describe 個 elements contributing to therapeutic nurse-patient relationship，describe the phases of therapeutic nurse-patient relationship discuss how mental health nurses use therapeutic nurse-patient relationship to facilitate the growth of clients, explain the characteristics of transference and counter-transference, discuss legal strategies to prevent and manage transference and counter-transference。咁首先要嚟講下呢個咩叫 nurse-client relationship 啦。咁呢個就係一個 interaction 啦，喺病人同埋 nurse 之間呢個 interaction 啦，which input from both participants contributes to a climate of healing, growth, promotion, and illness prevention。咁一個 a therapeutic nurse-client relationship is essential to the client's health and well-being and is grounded in trust, respect, and empathy, foundation of safe, effective, and ethical nursing care. Directly influence how well clients engage in care, follow treatment plan, and achieve better health outcomes。簡嚟講就係 grounded in trust, respect, and empathy 啦，forms the foundation of safe, effective, and ethical nursing care 啦。Directly influence client engagement 啦，adherence to treatment plans and health outcomes。咁就有對病人嗰個 engagement 啦，同埋佢哋個配合度啦。仲有個治療嗰個成果有直接關係嘅。咁一個 therapeutic relationship 就有包括啦 builds trust and safety 啦 ，support client-centered care，protects dignity, autonomy and boundaries, guides ethical and legal practice, improves communication and understanding, promotes better health outcomes, provides emotional support and hope。咁講呢個 nurse responsibilities in a therapeutic relationship。咁一個護士應該 recognize the power imbalance and avoid misusing their power 啦，即係知道有咩力量嘅唔平衡啦。咁病人同埋nurse 之間嗰個權力係唔一樣嘅，咁我哋又唔應該濫用我哋個 power。Establish and maintain the therapeutic relationship through trust, empathy, and respect. Demonstrate culturally safe and inclusive client care. Demonstrate respect for the values, beliefs, and identities of every client. Focus on the needs, preference, and well-being of the client. 咁仲有 protect the client's dignity and personal privacy. When providing physical care，咁我哋 particularly during physical contact，咁我哋應該要 recognize the client's vulnerability，我哋知道有咩弱點啦。咁 clearly communicate with appropriate terms for the intended care, obtain consent, document care, communicate in a respectful way that promotes dignity and trust。咁我哋應該知道病人有咩弱點啦，咁同佢哋溝通清楚啦，用合適嘅字同佢哋溝通清楚治療嗰個目標啦，咁仲要佢哋嘅同意啦，咁仲有我哋要記錄低治療嗰個過程嘅。咁就咁就講到呢個 difference between social 應該講到呢個 difference between social relationship and therapeutic relationship。咁social relationship 嘅 purpose 係 interaction provides companionship, recreation, and support for both parties。咁 therapeutic relationship 就係 the focus is health promotion, behavior change, and growth for the client。 basis 就係呢個 social relationship 啦，parties share equal give and take。therapeutic relationship 就係 the nurse cares for the client，the client is not expected to respond to the nurse's personal needs。superficial discussion 就係呢個 social relationship 就係呢個 exploration of topics such as the weather, sports and television programs is normal。therapeutic relationship 就係 introducing the nurse background and personal preferences, blurs boundaries, distracting from the task of therapeutic change。咁 self-disclosure 就係呢個 social relationship 啦。Both parties engage in increasingly free and revealing exchange as the relationship develops. In therapeutic relationship, the nurse facilitates the client's self-disclosure to promote change and growth. The nurses use self-disclosure only when it serves the client's needs. Conflict 就係 social relationship both parties may argue freely with relatively few constraints on words and emotions。therapeutic relationship 就係 the nurse uses therapeutic communication skills to listen, comfort, and set limits with clients while remaining calm, professional, and respectful. Even when the clients are out of control, rude or inappropriate, the nurse models appropriate communication. Termination 就係呢個 social relationship may gradually fade or abruptly end if dissatisfaction or distance develops. Conversely, the relationship may be lifelong. Therapeutic relationship 就係 the nurse initiate and encourage discussion of any problems or behaviors that disrupt inhibit the relationship. Termination is expected once the client resolves the presenting problem or moves to another therapeutic setting. Termination is planned and deliberate with therapeutic value。簡單嚟講就係有5個 aspect 啦 ，therapeutic relationship 同埋 social relationship。咁個 purpose 就係therapeutic relationship 先啦，個 purpose 就係 health promotion、behavior change and client growth。咁 social relationship 就係 companionship、recreation、mutual support。咁 social relationship 就比較雙向啦，即係兩邊都要講多啲關於自己嘅嘢。咁therapeutic relationship 就係比較專業嘅，就係淨係個病人去講嘅啫，唔關個 nurse 事嘅，即係個 nurse 唔需要講話咩關於自己嘅嘢。咁expectation nurse care for client not expected to meet nurse's personal needs. Both parties give and receive equally. 咁個 boundaries 咧就係 clear professional limits, self-disclosure only when it benefits the client。咁 social relationship 就係 free informal sharing of personal preferences。咁就講乜嘢都會講嘅，不過 therapeutic relationship 就係比較專業啦。咁都係講翻自己，即係例如 nurse 講自己嘅興趣都係喺有助於病人前提下講，唔係話就好似吹水咁樣乜都講。咁 communication structure therapeutic skills 咁包括 listening 啦、comforting 啦同埋 setting limits。咁 social relationship 就係 casual 啦 ，fewer constraints on language or emotion， 即係比較偏向於吹水啦。咁 therapeutic relationship 就係個 termination 就係 planned purposeful once goals are met or clients transitions。咁social relationship 就係 may fade gradually end abruptly or continue long term。咁講到呢個 core elements of a therapeutic nurse-client relationship 啦，咁第一就係呢個 self-awareness 啦。The nurse examines their own feelings, bias, attitudes, emotions, thoughts, and actions。咁呢個 The Johari window of self-understanding on a mental health nurse increases awareness of his emotions, actions, and thoughts。同埋呢個 values clarification 咧。Through value clarification, the nurse can discover their own values by exploring, assessing, questioning, and choosing what their values are, and how these values will influence their attitudes. emotions, and actions. By clarifying one's own value, the nurse can avoid projecting or imposing her own value system onto a client. Genuineness. The nurse should be open, honest, and authentic in interactions with the clients. Way to demonstrate genuineness. Uh, Acknowledging how difficult a client's problems are for them and their efforts to change. Showing interest in the client's day-to-day progress. 咁仲有呢個 empathy 咧，encompass the ability to feel in oneself or recognize the feelings experienced by someone else as if they are our own. Includes the ability to objectively understand someone else's point of view or communicate an intention to understand another person. Involves listening carefully to the client has said, being tuned in with what the client said, and having insight into the meaning of his thoughts, feelings, and behavior. Empathy contributes to the quality of this relationship by enhancing the nurse's capacity for ethical decision making and fostering meaningful connection with the client. 咁仲有呢個 empathy 咧，the ability to understand and share the feelings of another. Sympathy 咧 means feelings of pity and sorrow for someone else's misfortune. 一個係同情咧，一個係共情。咁講呢個 components of nurse-client relationship 啦，有呢個 unconditional positive regard, therapeutic use of self, collaboration, trust, warmth, consistency, therapeutic skills 仲有 boundaries 嘅。咁講下 A 先咧，呢個 unconditional positive regard, show respect, remain non-judgmental, and believe in the worth of and dignity of another individual. 咁仲有呢個 accept the client exactly as he is, even though he may have conflicting values, opinions, and lifestyles. 咁仲有呢個 can be demonstrated by calling the client by his name, allowing enough time to spend with him, answering questions and talking about his concerns, being open and honest with sometimes difficult topics, trying to understand the motivation behind the client's behavior, taking into consider the client's wishes when planning nursing care. 咁仲有呢個 B 咧，就係呢個 therapeutic use of self. Unconscious use of a nurse's own unique personality and empathy as therapeutic tools to assist a client to develop positive relationship and provide structure to nursing intervention. 咁仲有呢個 be aware of his own value, attitude, and belief and acceptance of the uniqueness of and difference in the client. 咁仲有呢個 collaboration 咧 ，nurse and the client work together, exploring the client's problems and needs, set goals, plan outcomes and ways to meet their goals, evaluate the effectiveness of intervention as well as progress made towards meeting mutually established goals. 咁仲有呢個 trust building block of a therapeutic nurse-patient relationship. Being genuine, consistent, and empathetic are essential to build trust. Use the trust to help persuade the client to engage in treatment and behavior for their benefit. Trust between a nurse and a client may be difficult to re-establish once this is broken. 咁仲有呢個 warm 啦 non-verbal manner that a nurses express interest in a concern for a patient. 咁 conveys warmth by assuming a positive attitude, smiling, leaning forward, and listening actively. 咁仲有呢個 consistency. Consistency is the sameness, maintaining a routine, being honest, following through with promises, responding in a predictable manner, and reinforcing rules uniformly. 咁仲有呢個 important for mental health nurse to maintain consistency to the best of their ability through his care of a client, and takes every effort to explain the reasons why he cannot fulfill a promise or meet a client at a prearranged time. 咁仲有呢個 G 啦，therapeutic skills、therapeutic listening skills and therapeutic communication，咁 two invaluable skills when establishing and maintaining therapeutic nurse-patient relationship。咁仲有呢個 H 啦，boundaries 啊。咁阿 Morgan 咧就講咗 four types of boundaries：material boundaries、social boundaries、personal boundaries、physical、emotional。咁仲有呢個 professional boundaries 啊，limit and outline expectation for appropriate relationship with clients. It sets realistic limits on behavior, communication, and interaction so that the clients know what behavior to expect from the nurse and what behavior is expected from them. 仲有呢個 professional boundaries 啊，the relationship exists on a continuum ranging from professional and appropriate behaviors to personal and inappropriate ones. Power of the nurse comes from the nurse's professional position and access to sensitive personal information, and boundary violations can occur through under-involvement or over-involvement. Regardless of the intent, a boundary violation may be considered professional misconduct，即係越界啊。咁 boundary violation 又有 under involvement 同埋 over involvement 啦。under involvement 就係 disinterest、neglect、abandonment。咁仲有呢個 over involvement 啦，favoritism、spending more time with client。咁講翻嗰啲 trust components 啊，咁有1、2、3、4、5、6、7，有7種 components 啊，一個 consistency 啦，就 predictable behavior 啦，keeping promises 啊，transparent explanations 啊，咁 therapeutic skills 啊，包括呢個 active listening skills 啊，open-ended questioning 啊，reflection 啊，同埋 motivational interviewing。咁 unconditional positive regard。accepting the client as they are without judgment。咁仲有呢個 warmth、non-verbal cues、smiling、leaning forward、attentive posture。咁仲有呢個 boundaries、clear limits on role、communication and expectation。咁仲有呢個 collaboration 啦，joint goal setting and evaluation of progress。咁仲有 therapeutic use of self、conscious deployment of the nurse's personality and empathy as tools。咁講到 professional boundaries，a clear distinction between a nurse's behavior, prioritize meeting the therapeutic needs of the client，仲有 focus on the personal needs of nurses。咁就係100% prioritize meeting of the therapeutic needs of the client，就唔係 focus on the personal needs of the nurse 嘅，就只係得0%嘅。咁 professional boundaries 個To maintain professional boundaries, nurse ensure the focus of the therapeutic relationship is on the needs of the client and not on the personal needs of the nurse。即係話我哋個 focus 應該係喺點樣去治療個病人，而唔係我哋自己個需要。Recognize when the boundaries of the therapeutic nurse-client relationship are at risk of being compromised and take action to protect them。簡而言就係要知道我哋有冇越界啦，即係有冇跨過呢個界線啦，同埋要去行動去保護佢哋。咁仲有呢個are responsible to clarify and reinforce the boundaries of the therapeutic relationship 啦。咁仲有 recognize there may be an increased need for vigilance, maintaining professionalism and boundaries in certain practice settings。咁仲有呢個 refrain from participating in financial transaction between clients or the client's family outside the provision of care。咁 limit the sharing of their personal information with clients and share information that supports the therapeutic relationship。Refrain from entering friendship or personal relationship with clients。Do not interfere with the client's personal relationship, including not engaging in personal or sexual relationship with the client's family. Document any approach or activity that is part of the client's care plan. Refrain from accepting and giving gifts. Refrain from using electronic communication and social media with clients or personal use. Avoid providing nursing care to family or friends, and whenever possible, transfer care to another healthcare provider, consult with a colleague or manager in any situation in which there are concerns about professional boundaries, and report concern of boundary violation to the appropriate person。咁簡歷嗰個 guidelines 係 keep the focus on client needs 啊，not personal desire 啦。咁都係病人優先啊，而唔係我哋自己要乜嘢。咁 detect and protect boundary integrity when at risk 啊，咁有風險嘅時候，我哋就要知道同埋要保護翻個界線啦。咁 clarify and reinforce limits with the client 啦。咁仲有 exercise heightened vigilance in settings with greater risk long-term care。咁個 prohibit action 我哋唔可以做嘅嘢就係有金錢上交流啦。咁仲有講我哋關於我哋個人嘅 detail 咧，beyond what aids therapy，即係我哋唔係嚟吹水嘅，我哋只係講一啲關對治療有關嘅嘢。咁仲有呢個 developing friendship or romantic ties 咧，係唔可以有友情，即係我哋係專業嘅關係啦，唔係友情同埋愛情上關係啊。咁 interfering with clients' personal relationship 啦，accepting gifts, using social media for personal contact, or providing care to friends without referral. Document any boundary-related activity and consult a colleague or manager when concerns arise. 咁呢個 boundary 啱啱講到嗰個 boundary violation 又分為呢個 under involvement 同埋 over involvement 啊。under involvement 嘅 disinterest 啊、neglect 同埋 abandonment 啊。over involvement 嘅 favoritism、excessive time through relationship。咁講到呢個 phrase of the therapeutic relationship 啊，咁第一就係有呢個 pre-interaction phrase 啊。Before the first meeting between the nurse and the client, major tasks of the nurse are self-exploration of his own feeling, fantasies, or fears, analyze his own professional strengths and limitations, gather as much information about the client as possible, and plan for the first meeting with the client。咁呢個第二就係呢個 introductory or orientation phase。咁一就係 when the nurse first meets the clients 啊，咁二就係 establish rapid and build a foundation for further work。咁三就係呢個 task of nurses 啊，咁就係呢個 find out why the client sought help, focus the client's problem and determine the motivation of client for treatment. Consider the help seeking varies among social and cultural groups. Establish partnership relationship with the client, agree on the nature of the problem and treatment goals for the client, establish formal or informal contracts with the client。咁就係呢個 keeping the appointment 啦，limits of confidentiality, types of problems to be addressed in the process of re-evaluating expectation and goals。仲有呢個introductory or orientation phase 咧，咁四就係仲有呢個 task of nurses 下啦，四就係呢個 testing behaviour of patient, test the commitment of the nurse by acting out or missing appointment, may show his worst behaviour such as challenging or withdrawn behaviour to test whether the nurse can handle the intensity of his problem。working phrase 係一就係個 behavioral change 啊，actual behavioral change of the client is the focus of this phrase。actively involved 啦，the client is actively involved in achieving goals set during the introductory phrase。makes progress. The client makes progress through testing new behaviors, identifying resources, and discovering ways for change。咁 nurse use 呢個 therapeutic communication techniques 啊，包括啱啱講過嘅 active listening 啦、open-ended questions 啊、reflection 啦、clarification 啦，仲有 motivational interviewing。 Nurse explore goals, strengths, coping strategies. Implement targeted interventions aimed at short-term relief and long-term outcomes。咁六就係呢個 power struggles。Power struggles and resistance behaviors may occur in the working phase. The nurse or the client may attempt to exert more control over the relationship or compete for control over the relationship. The struggles may be due to existence or transference or counter-transference. The client may show resistance or testing behavior, such as asking personal questions, acting out anger inappropriately, withdrawing socially, and using manipulation by trying to get attention, sympathy, or being dependent rather than independent. Strategies to deal with resistance or testing behaviors are包括 state clearly what the nurse observes and attempts to engage the client in exploring reasons behind the behavior. 咁仲有呢個 reinforce acceptable or inappropriate social behavior 啦。Leave the situation temporarily if necessary. Tell the clients on what the nurse knows he is capable of doing for themselves. 四就係呢個 termination phrase 一就係 the nurse and the client exchange feelings and memories and to evaluate mutually on the progress of the client and goal attainment。二就係呢個 successfully termination requires the clients work through feelings related to separation from an emotionally significant person。Some decline may experience loss and sadness due to the ending of the time spent with the nurse of termination of this relationship. The client may show regressive behavior, showing original symptoms or testing the nurse's belief in the client's ability to function independently. 四就 show clients may feel rejected or withdrawn prematurely to protect against the pain of grief, while others may try end the relationship angrily and abruptly. 咁就係呢個 the nurse can help by allowing the client to experience and feel the effects of the anticipated loss, to express the feeling arising from the about to happen separation and the related those feelings to former symbolic or real loss. On the obstacles of therapeutic relationship 就係 inappropriate boundaries ，counter-transference 同埋 resistance。Inappropriate boundaries 就包括 cross professional limits, compromising the therapeutic relationship and the client welfare, compromising role boundaries, disclosing excessive personal information to clients, engaging in true relationship, social, financial, romantic, accepting gifts of money from clients or families, meeting clients outside clinical settings without justification. Warning signs about preferential treatment of certain clients, reluctance to discuss case with colleagues, keeping secrets with clients, feeling that you are the only one who can help the client decision based more on personal feeling. 仲有 resistance is a normal defensive response when clients feel threatened, anxious, or not ready for change. Resistance is natural, reluctant, learned, avoidance of verbalizing or experiencing anxiety-producing aspects within self. Ambivalent attitudes towards self-exploration and of anxiety-producing experience. Manifest as missed appointment, silence, hostility, or superficial engagement. Often reflect fear of vulnerability, past negative experience, or ambivalence about treatment. 仲有呢個 transference Unconscious feelings and thoughts toward a mental health nurse in which the client projects an imagined image about the nurse. Frontons may be harmful to the process of nurse-patient relationship if it is ignored or examined, characterized by the inappropriate intensity or responses of the client. Positive transference does not need to be addressed with the patient. However, the nurse may need to explore negative transference that threatens the nurse-patient relationship. 咁就 two types of transference. Hostile transference, the client internalized anger and hostility, which may be expressed as depression and discouragement. The client may ask to terminate the relationship on the ground that he has no chance of getting well. If the hostility is externalized, the client may become critical and irritable, having a lot of complaints and may query about the experience and competence of the nurse. He may spend time to source information to debate on intellectual issues rather than working on his real-life problems. Dependent transference. The client becomes submissive and subordinate. Nurse-client relationship is jeopardized because the client overvalues the characteristics and qualities of the nurse. The client makes and continues to demand overwhelming and unrealistic expectation of the nurse. He or she is filled with hostility and being looked down if the demands are not met. 咁呢個 counter interference, counter transference, reaction of the intense love or caring, reaction of intense anxiety often in response to resistance by client, reactions of intense disgust or hostility. A mental health nurse displays all projects unconscious feelings, desires or actions from a person in his life onto the client. When the nurse recognizes counter transference, he or she should exercise control over it. Counseling or supervision is helpful if the nurse needs help to deal with counter transference. 講返啱個 phrase of the therapeutic relationship 啦，總結就係 pre-interaction 啦，就係呢個 self-exploration 啦 ，assessment of limits 啦同埋 strengths 啦 ，gathering client information， 咁 orientation 就係 identify why the client seek help, establish partnership, set goals, negotiate contracts, time, confidentiality, problem scope, test client commitment, Mr. Appointments. 咁三就係呢個 working phrase focus on behavior change, client actively pursues goals, setting orientation. 咁 nurse employs therapeutic communication 啱講過 active listening, motivation 仲有 interviewing 啦。咁仲有呢個 manage power struggles and resistance。咁好似拔河咁樣。咁 termination 啦，第四就係 termination phase。Mutual evaluation of progress and feelings about ending the relationship. Allow client to process loss, grief, or regression. Nurse supports emotional expression and ties to past experience. 咁個 obstacles 喺呢個 therapeutic relationship 個 obstacles 就包括 resistance 啊、transference 啊、counter transference 啊、inappropriate boundaries。呢個 defensive response 啊、Mr. Appointments 啊、silence 啊、hostility 啊 when client feels threatened or anxious。Client projects unconscious feelings onto the nurse 啊 dependent or hostile 就敵對或者好依賴佢啦。仲有呢個 nurse intense emotional reactions, love, anxiety, disgust toward the client. 咁仲有呢 inappropriate boundaries 啦 true relationship 啦 personal disclosure 啦 gift accepting 啦 social media contact 啦。咁點樣 manage 呢個 resistance, transference 同埋 counter transference 咧？就包括 reinforce acceptable social behavior 啦 set clear limits 啦 temporarily step back if the situations escalates. State observations objectively and invite exploration of underlying reasons. Empower clients by reminding them of their capabilities. For transference, identify negative transference and explore its impact. Positive transference can be acknowledged but need not be deeply explored. For countertransference, recognize strong emotional reactions, seek supervision or counseling to process feelings and maintain professional conduct。呢課我大致上講完呢個 therapeutic nurse-client relationship。咁就要拍埋呢堂 tutorial historical fields of mental disorder，仲有 mental health nursing 啦。咁呢啲係上嗰個 tutorial 嗰啲題目啦。咁 how did the evolution from asylum to modern mental health service change what nurses do? In asylum settings, nurses' work was largely custodial, maintaining order, supervising large numbers of inpatients, and implementing medical treatment within rigid institutional routines, often in overcrowded conditions. The institutionalization and community care shifted nurses into smaller wards, outpatient clinics, and community teams, where they now focus on therapeutic relationship, psychoeducation, home visits, early intervention, and recovery-oriented support rather than long-term institutional containment. Which historical milestones in legislation, policy, for example, the institutionalization, patients' right, community care, most effective nursing practice. The institutionalization policies from the 1960s to 1980s in many countries closed or downsized psychiatric hospitals and invested in community mental health teams, creating new roles such as community psychiatric nurses and home-based cares, and requiring skills in case management, crisis work, and interagency collaboration. Legislation on patients' right and community care, mental health acts, guardianship, laws, rights to informed consent, and least restrictive care push nurses to work with legal frameworks, support shared decision making, and document care that respects autonomy, dignity, and safety. How have stigma and public perceptions changed over time in your own culture or context? Over recent decades, public mental health literacy has generally improved, with more people recognizing conditions such as depression and schizophrenia as health problems rather than moral failings. Through stigma and social distance remain, especially for psychotic and substance use disorders. In many East Asian contexts, including Hong Kong, family responsibility, faith, and concerns about shame still influence help seeking and disclosure, but gradual expansion of community services, school programs, and media campaigns is increasingly openness and willingness to discuss mental health. Given this history, what should be the key responsibilities and efficacy roles of mental health nurses today? Clinical responsibilities now emphasize therapeutic engagement, evidence-based interventions, for example, psychological, psychosocial, and pharmacological, risk assessment, physical health monitoring, and coordination of care across hospital, primary care, and community settings. As advocates, mental health nurses should challenge stigma and discriminatory practices in health service and the wider community, promote patients' rights, autonomy, and inclusion in education, employment, and housing, involve families and carers in collaborative care while respecting confidentiality, contribute to policy discussion, service design, and quality improvement to ensure service are recovery-oriented, culturally sensitive, and accessible. 咁仲有呢堂 fundamental 唔係 nurse-client relationship 啊嘅 tutorial 啦，我 miss 咗咁拍埋呢個咁啊 Miss Chan 就係一個 RN 啦，working on an acute psychiatric ward. She has been caring for Mr. Lee, 一個28歲嘅男人 admitted with severe depression and suicidal ideation for the past 3 weeks. During the first days of admission, Mr. Lee was withdrawn and spoke very little. Over time, he began to open up more during one-to-one section with Miss Chen and now often waits for her specifically when he wants to talk.
Recently, Mr. Lee has started to bring small snacks for Miss Chen in the beginning of each shift, saying, "You are the only one who really understands me. I don't know what I will do without you." When Miss Chen reminds him that the whole team is there to support him, he replies, "No, they don't care. Only you care. You are like my older sister, who always protected me when I was a child." One afternoon, near the end of her shift, Mr. Lee becomes upset when he learns that Miss Chen will be on leave for a week. He raises his voice and say, "How can you leave me now? You promised you would help me. If you go, it means you are just like everyone else who abandons me." Miss Chen feels guilty and finds herself staying 20 minutes after her shift to talk to him, even though another nurse is already assigned to take over his care. She begins to think about Mr. Lee after work and worries whether he will cope without her. On her next shift, Mr. Lee asks Miss Chen if he can add her on social media after discharge so we can keep in touch as friends. Miss Chen feels uncomfortable but also flattered that he trusts her so much. She hesitates, thinking maybe just one private account would be okay so I can check how he's doing, but she is unsure what to say in the moment. Among discussion. Which elements of a therapeutic relationship are present? Which elements of a therapeutic relationship are missing or at risk？咁 at risk 嘅就應該係有一個 boundary issues 啦。咁根據翻個 scenario 咧，Mr. Lee 咧就有 give 呢個 snacks 啊，同埋 personal contact request 嘅，即係啱啱呢度講話加去 social media 啦。咁仲有咁個 personal boundaries 就 at risk 嘅。咁仲有 at risk 嘅就係呢個 over involvement 啦。咁如果呢個 staying after shift and thinking about the client outside work show a risk of dual relationship and over identification。咁仲有呢個 self disclosure 啦。Exchange reminders that the whole team supports him may be insufficient。咁 the client is still being positioned as only you in his work。咁作為一個護士咧，how the nurses should respond。Mr. Lee treats Miss Chen as an older sister and projects amid childhood nears onto her. Counter-transference. Miss Chen feels guilt, a desire to rescue him, and flattery may be steering her to over-involvement. 咁作為一個 nurse 咧，我哋應該 re-establish 一個 limits 啊，thank him for the snacks, explain things cannot be accepted, redirect gratitude to the whole care team。即係唔可以收受呢個啲禮物啦。咁 decline the social media request politely 啦，explaining that professional communication stay within the healthcare settings。咁成件事都係 based on 呢個 healthcare setting 嘅，而唔可以有任何嗰啲私交啦。咁仲有 plan for leave 啦，arrange a handover with another nurse, review the care plan together, and reassure the client that the team will continue support。咁仲有呢個 document every boundary discussion and any personal feelings that arise, seek supervision or debrief with a senior colleague。what signs of transference and counter transference involved？咁就係啱啱講過啦，呢個 transference 就係Mr. Lee treats Miss Chen as an older sister and projects unmet childhood needs onto her 啦。咁 counter transference 就係呢個 Miss Chen feels guilt a desire to rescue him and flattery that may be steering her toward over involvement。咁 how the nurse should manage them safely 咧？咁就係 self-awareness 啊，recognize her emotional reaction, label the counter-transferential feelings, and use the Johari window or reflective journaling。咁仲有呢個 supervision 啊，discuss the case with a mentor or clinical supervisor to gain perspective and develop a boundary-focused plan。咁 therapeutic use of self 啦，remain authentic 啊，but limit this self-disclosure to what serves the client's goal。Use empathy to validate feelings without reinforcing dependency. Re-educate the client about the therapeutic contract, emphasizing that care is a shared, team-based process, not a one-to-one friendship 啊。咁主要都係提醒翻個病人啦，呢個係成個 team 嘅治療過程咧，而唔係一對一嘅。咁就唔好令到佢更加依賴咁就唔好令到 Mr. Lee 更加依賴Miss Chan 啦。